correlation between experimental data obtained in models to patient-related cognitive deficits. So I went through the impact that amyloid has on the blood vessels of the brain and how that may constitute one of the earliest manifestations in a mouse model, and how recent evidence from the ADNI study, which is a huge imaging cohort, show the same thing in patients. So the changes in the blood vessels seem to be a very early biomarker of disease. It could possibly be part of a palette of biomarkers that you're going to need because of the multifactorial nature of Alzheimer's disease. And then I showed evidence how high blood pressure, which is a major risk factor for dementia, by producing either strokes or by damaging the white matter. It connects to different parts of the brain and causes a disconnection syndrome. In other words, the regions of the brain don't talk to each other as efficiently because there are these roadblocks, right? The white matter doesn't quite connect. And this leads to the classical, executive dysfunction. So people cannot make good decisions anymore. And the kind of psychomotor slowing. So they can remember, they can calculate, but it's going to take them longer to do that. That's the classical manifestations of hypertensive-induced white matter disease. And so we discussed what are the mechanisms for that, and how much of this is also true in patients in terms of how well established the impact of high blood pressure, even without causing, overt strokes or in terms of impact in cognition. There are a couple of studies that show that high blood pressure, no matter, even if the brain is intact, quote unquote, still is going to have a negative effect on the hypertension. Then we presented some of the latest data we have, in which we found that there is a connection between dietary salt and tau in the brain. So tau is one of the major factors in Alzheimer's disease that causes synaptic dysfunction. And we found that if you eat enough salt, you're going to get the same thing happening to the brain without having Alzheimer's disease in a relatively young setting. And then there's data now emerging from the clinical literature that link, groups of people who have excessive amount of dietary salt intake, for example, in East Asia, and the incidence of minimal cognitive impairment in that particular population. So it looks like, if you populations where there is an excessive amount of salt intake, there is also a propensity to develop, cognitive impairment. And then other studies have shown that if you use, the Mediterranean diet and other dietary interventions which have been shown to kind of ameliorate cognition, the reason why they work seem to be due to the fact that there is a lowering of salt. Usually these diets are very low in salt. So those are kind of putting it together, essentially how the point is that, the vessels of the brain can really have a big impact on cognition, either in the setting of well-defined vascular risk factors, so like salt and hypertension, right? But also in the context of Alzheimer's disease, where that wasn't, is not considered now a major component, at least in terms of conceptually the disease. I mean, if you look at the pathology, the data tells you otherwise, all right? If you look at people who have all comers, in the community who develop dementia, only about a fourth of them will have pure Alzheimer's pathology. The majority of them will have mixed dementia, all right? Whatever these vascular factors are, you're going to need to address them if you want to treat dementia in the community, all right? Not in very selected, highly selected groups of patients which do not reflect the impact of in the community. So you're going to have to use a more kind of personalized approach, targeting different aspects that may be impactful and causing the cognitive impairment.